My name is Chris Barnes, and I'm the clinical director here at Kiwatinook and Inumino Incorporated. And I am leading the healthcare transformation and innovation clinical projects. Today, we have invited partners for our first annual education day for the clinical services department. And we had speakers such as Mariah Davis, the CSO, and Dr. Barry Lavallee as the CEO, as well as myself, who gave updates on the clinical services programs and services. We invited the partners such as the Radyverse, who is giving some demonstration and information on some of the innovative virtual reality technologies that they're working on at the Faculty of Medicine and the faculties of Nursing at the University of Manitoba. And the purpose of today's event is to bring partners together to learn about anti-racism, to learn about KIM governance and healthcare transformation, and also to explore innovations in healthcare services and programs, and bring partners together to figure out innovative ways that we can move forward to advance healthcare needs for First Nations in Northern Manitoba.
This is part of our Radyverse. This is a software called Lumetto. It allows you to do clinical simulations with VR patients. There's a few different ways you can use it. You can use it for interview skills, history and physical, and then you can use it for crisis management, so codes and resuscitations. What we're going to demo here today is a difficult conversation with a patient that's driven by artificial intelligence. I think using VR in general is a great way to make simulation portable and can be done through multiple sites simultaneously. So we can participate in sims together here in Winnipeg with groups that are often rural and remote locations. So it allows you to bring experts to areas where they may not necessarily be able to travel there.
Good day to everyone. My name is Carlo Pang, and I'm from the College of Nursing, University of Manitoba. We will be introducing body swaps and Oxford Medical Simulation. Those two are virtual reality applications that is used for communications and as well as healthcare simulations.
And my name is Jeannie San Miguel. I'm the interim director of digital strategies. And when the College of Nursing launched a VR program for their simulation program, Carlo and myself were part of that. So we recently launched a professional development course for international nurses. So we use virtual reality and virtual simulation heavily in terms of that, so that we can reach remote communities out of province, sometimes international. And we also use VR in terms of assessments internationally.
Well, with technology being available and the experience that we can offer, I can say that if we can do it globally, why not here in Manitoba?
How can we partner together to help with the overall idea of innovation projects to advance First Nations health and wellness?